So in this video, we're going to be going over some neurological testing for lower back pain. And a common test you see is the slump test. So I'm just going to review how it's done, what you should be looking at. So you should have a partner. You can do it on your own too. I like to do it passively. So I'm going to take Greg's leg and I'm going to extend it up. And then from here, what I'm going to tell him to do is bring his chin to his chest and then slouch forward. Good. If someone has an acute kind of nerve irritation, this is going to bother them down the leg, potentially in the back. They might have local pain to the back. If someone doesn't have symptoms right there, what you can do is go ahead, come down, is you can bring the ankle up a little bit. And what you're doing is you're stretching the nerve in essence. So you'll have shooting pain down the leg if someone has severe disc or any sort of neurological issues there. All right, so in this video, we're going to continue with a nerve assessment of the lumbar spine. A lot of times, what you have to look at if the nerves are being affected are the strength of the lower extremities. They really are affected if you're having either a serious disc herniation, which is affecting your motor units, or potentially like a really nerve irritation that's just affecting everything. So with any sort of muscle testing, you want to test the nerves that are drastically affected, what we call myotomes. So when I look at someone and I'm trying to put this clinical picture together, I'm looking at their myotomes, if they're having any pain down the leg, if they're having numbness, they're having weakness. Okay, a couple big ones to look at. One is hip flexion. How does their hip look? So lift your hip up. From here, we're going to be applying pressure and pushing down. Good. And someone who's weak is going to just drop. So let's try again. In that scenario, you may have something that's affecting the nerve root, okay? If, for the most part, or clinically or textbook, you're not gonna have weakness in this specific kind of myotome, which is L2, L3. So the next myotome you wanna test is gonna be knee extension, which is L3. So in this position, obviously if someone is acute or if they have a lot of pain down the leg, you gotta be careful because you can really irritate them. But from here, bend your knee. I'll just have someone kick it to my hand and just feel where their strength is at. I'm always testing both sides because that's what's going to give you your clinical picture. The next one you want to move down is the dorsiflexion, which is L4. Hold the ankle up. From here, don't let me push down. Good. And then the last one, or there's two rather, you could test L5 and then S1. So L5 is the big toe. Hold it up. Good. Don't let me push down. Good. A lot of times you'll see, right, L4, L5 is traditionally the one that's affected the most. So people will have weakness with dorsiflexion and the big toe. And a lot of times what I'll see if someone is a true kind of like textbook example of this, if I ask them to kind of bring their foot up, just their ankle like dorsiflex, instead of coming straight up, the foot will actually kind of come up almost like inverted. They're compensating to the point where the foot's inverting. So you have to keep your eyes open for that too. And the last one you want to test for myotomes is really the S1 hamstring area. Kind of don't let me push you up. Good. And you'll find weakness there too in these textbook kind of examples. So that's a myotone assessment for anything nerve related in the lower back.